Hello Staff Advocates, this is Soren Chanel with the Community Clinic Consortium. I'm hitting you again with another update on national healthcare reform legislation. Last time I sent out an update, the legislation had just made it to the United States Senate, having passed the House of Representatives. And as you will remember, the bill needs to pass both the House of Representatives and the Senate, and then go to a conference committee where a final version will be sent to the President for signature. So we're still in the Senate waiting for them to take action, and over the last couple weeks what's happened is that the senators have been debating really just a few really highly politically charged issues, including abortion, and the question they've been wrestling with is whether federal plans that will be offered under the healthcare reform will be allowed to cover abortion services at all. And the vote that was taken just 2 days ago answered that question, yes, that plans that are offered within the coverage under healthcare reform will be allowed to cover abortion, but as it's in current law, the premiums for abortion services specifically will need to come from the people who buy the plans and will not be subsidized by the federal government. But like I say, there hasn't been a lot of progress in the Senate bill beyond just a couple of these sort of highly publicized issues, and the bill hasn't moved in any significant way towards a resolution that would get it the 60 votes it needs to pass the Senate. That is until yesterday, in where a sort of gang of 10 senators, 5 liberals and 5 centrists, got together and came up with a compromise idea for the legislation that may be the sort of kernel of an idea that gets the bill out of the Senate and onto conference committee. The idea basically boils down to two things. Instead of a public plan, instead of the public option, the federal government would basically extend the health insurance plans that it currently offers to its own federal employees and allow those plans to be offered nationally to people through insurance exchanges that would be set up in each state. So in other words, when you hear congressmen and senators say that they want to extend the same types of coverage and same types of insurance benefits that they have as members of Congress to the American people, that's what they're talking about here, that they hope to extend their own plan to just normal everyday people who could buy into it, hopefully at affordable rates. The other major part of this sort of Gang of 10 agreement would be that people who are 55 and older would be able to buy into Medicare. So now, as I think everyone knows, Medicare starts at 65. The agreement would be to allow people who are a decade younger than that, or starting 55 through 64, would be able to purchase Medicare insurance, possibly at a higher rate than people have to pay for it who are 65 and older, but still that would be a major expansion of what has been a pretty successful federal program. This is something that has liberals excited and centrists and conservatives pretty nervous. So we'll have to wait and see what the cost estimates are for this proposal before anything is made real. So that's the sort of quick and dirty update. What's happening now? The progress seems to have been jump-started by this Gang of 10 agreement, and hopefully that means that before too long, before the President's State of the State or State of the Union address in January, that something is actually passed on to him in the form of legislation. Of course, I'll keep you updated and let you know when we need to take action to get things passed. Thanks. Bye.